All right, so to begin our introductions, my name is Sam Glazer-Hewson at the University of Minnesota Alumni Association. I'm so excited for today's topic, Understanding Cannabis in Minnesota today. We'll hear today from a group of folks who run the Cannabis Research Center, which is housed here at the University of Minnesota in the School of Public Health. And before we get to our speakers, just a few housekeeping notes that I would like to go over. Today's session is being recorded and it will be sent to everyone who registered for today's session and also uploaded to our Goldmine website for continued access. You'll also receive a follow-up email that includes our program evaluation and ways to keep being involved. As questions arise during today's talk, please feel free to submit them at any time using the Zoom Q&A feature, and we'll moderate those as they come in, as well as try to ask as many as possible during the Q&A session. All right, at this time, I'm actually going to hand it over to the director of our Cannabis Research Center, who will provide her own introduction, but please help me in welcoming Tracy Toomey.
Thank you so much. We are so happy to be here today. We're just going to pull up our slides as we get started here. It's such an interesting and important topic in our state as well as across the U.S. And so we're happy to be here to share some of the data that we've been collecting and tell you more about the Cannabis Research Center. I am Tracy Toomey, and as Sam said, I'm the director of the Cannabis Research Center, and began in October 2023 when the center started. And I have a long history of substance use research. My expertise through most of my career was the prevention of alcohol-related problems, including focusing on underage drinking and prevention of things like traffic crashes and violence associated with alcohol use. And for the last few years have been really focusing on cannabis. And again, we'll be sharing some of that information with you that we've been focusing on. I am a proud graduate of the University of Minnesota. I did all of my degrees at the University of Minnesota. The College of Liberal Arts is where I did my bachelor's degree. And then I did my master's of public health and my PhD in the School of Public Health at the University of Minnesota. I'm a behavioral epidemiologist, and that's focusing on problems that are at population or epidemic levels of and focusing on the behaviors that contribute to a variety of different health outcomes. In addition to me, you're going to hear from other graduates from the University of Minnesota that are part of the Cannabis Research Center team. That include the speakers include Kath Link, Eileen Delahanty, and Julie Sainum, and you'll learn more about them as we move through the presentation. Next slide. In today's webinar, I'll be providing a brief overview of the CRC history and an overview of our center and the mission of our center. And I will also provide a brief description of the cannabis policy landscape. What are the policy changes that have happened in Minnesota that affect cannabis sales and use in our state? And then you'll hear from Kath Link, who will talk about cannabis basics, products, and terminology. This is a very confusing area, and so I hope that it will be helpful to all of you. And then you'll hear from Eileen Delahanty and Julie Sainum, who will be talking about a few of our research studies, and then we'll have some closing time and time for Q&A. Next slide. So first, let's talk about the Cannabis Research Center. As Sam mentioned at the beginning of this webinar, we are housed in the School of Public Health at the University of Minnesota. So our primary focus is looking at public health outcomes. And we really strive to be a trusted source of information to the state of Minnesota. We hope that we conduct research that might guide policy changes and practice, whether it's in enforcement, education, or other types of things to implement the cannabis legalization policy in the state. To accomplish this, we conduct timely and Minnesota-specific research. We care and focus on issues related to equity. We want to provide interpretation and contextualization around the data that we collect and that others are collecting that may inform what's happening in our state. And we want to collaborate and be responsive to the needs and make sure that our data are accessible to all Minnesotans. And then finally, we do focus on training and supporting future practitioners and scholars focusing on cannabis. Next slide. The CRC was created as part of the 2023 bill to legalize adult use cannabis in Minnesota. And as I mentioned, we launched in October of 2023. The charge from the state legislature is that we must investigate the effects of cannabis use on health and also research other topics related to cannabis, including but not limited to prevention and treatment of substance use disorders, equity issues, education, and decriminalization. So as you can see, we have a very broad charge. Next slide. Since 2023, we have focused on conducting research at the same time, building a really wonderful team. And you're hearing from four of us. This slide shows you that we have many other staff members, faculty members, and students. And the asterisk indicates which ones of us have degrees from the University of Minnesota. And you can see that a lot of us do. Next slide. In terms of our mission, I just can't emphasize too much that we really believe we are providing a service to the state of Minnesota. And some of the work that we do is identifying and improving data sources. If we want to know what's happening, we have to have really good sources of data. And so we spend a lot of time thinking about that. Part of that is also creating new survey methods or other forms of data collection to answer questions that existing data sources don't allow us to do. We engage with the public. We build partnerships with state and local agencies and community organizations. And again, we really want to think about from an equity perspective, looking at what's happened in the past, but also going forward with cannabis and cannabis policy. A core part of our work is doing research, of course, as a cannabis research center. And so we do what we call core research, and you're going to hear some of our work. And we really focus on actively disseminating that research, not just through peer-reviewed research articles, but through briefs that we post on our website, through LinkedIn, and presentations like this. And we also fund other researchers on campus. So we have researchers that we funded in the medical school, School of Pharmacy, the Humphrey Institute, as well as other schools, bringing in other expertise to better understand what is happening with cannabis. Next slide. And this slide just gives you just a quick overview of the types of research that we are conducting. Things about looking at the implementation of the cannabis policy. So, how easy is it for young people to get access to cannabis at retail establishments? What are the needs of school support staff? What are the needs of local public health agencies? So those are some of the implementation and compliance type projects that we're focusing on. But we're also looking at use, prevalence of use at work, use while driving, sources of cannabis products. What are the potential benefits? What are the potential consequences? Ultimately, we want to look at the effects of legalization, and we want to look at other differences across groups, as from on a positive side as well as a potential negative side. Next slide. There are many challenges to doing research around cannabis. First of all, it is a Schedule I drug, which is the most restricted form of controlled substances that we have in this country. And that makes particularly clinical research very challenging to do. There are many different policy changes and they're overlapping, and that makes it hard to figure out what are the effects of a specific policy change. And I'll give you some information about some of the policies that affect Minnesota in a minute. And when we look at the effects of legalization, in the first month that I started in this position, I had a reporter ask me, when are we going to know the effects of legalization? Can I contact you in 6 months? Well, it's not that easy. Dispensers just started opening up. So we're not going to know the full effect of legalization until we have all of the dispensaries open for a while, and then we have the data to look at what are the long-term effects of legalization. We're working on building new data sources and improving them. I already mentioned that. But another complexity is that there are many different types of products in use, and you'll hear from Kath about some of them. That people eat it, they drink it, and they smoke it, they vape it, and they dab it. And hopefully that'll make more sense after today's webinar, but that adds to the complexity. And the policy environment keeps changing. Next slide. So let me give you a quick overview of the policies that affect what is happening in Minnesota. First of all, as I mentioned, that cannabis is a Schedule 1 drug. So that is the result of legislation that happened in 1970 at the federal level. In 2014 in Minnesota, we joined other states that legalized cannabis for medical use. And Minnesota developed a small medical cannabis program. Other states across the US, as I said, have done that before and after 2014. And then in 2018, in the federal farm bill, this gets a little complicated, but there was a loophole that basically descheduled the hemp form of cannabis. Hemp is bred usually for industrial purposes, for clothing, for rope, and other industrial products. But hemp also includes some THC, which is the psychoactive property of cannabis. And this loophole, that descheduled hemp, opened up the door for people to extract that THC from hemp products and insert it into things like the gummies and the seltzers, and thus kind of legalizing that form of cannabis. So we'll talk about hemp-derived THC products. And in 2022, the Minnesota State Legislature put some restrictions on those hemp THC products. So they established an age 21 use and sales age, and that isn't true in all states, and that's important to know. They also put regulations on packaging size, and they had a few other regulations. In 2023 is when Minnesota fully legalized cannabis for adults for outside of the medical cannabis program. And since then, the state has been working on implementing that particular policy. And building the Office of Cannabis Management, building a licensing system and enforcement system, and helping to support the development of this new industry. In 2025, the federal government made another policy change. They inserted language into the bill that reopened the government last fall and effectively banned hemp-derived THC products at the federal level. Now, this is not supposed to go into effect until fall. There's discussions and proposals to delay this policy change. We don't know what it's going to happen, if it's going to happen, how it's going to play out, and we don't know what the implications would be at the state level. But just know that that's happening in the background. And then finally, the president signed an executive order to reschedule marijuana from the traditional form of cannabis from Schedule 1 to Schedule 3, which would potentially make some type of research easier, not completely, but a little bit easier if that happens. And so the executive order doesn't make it happen. It just was trying to facilitate the process of moving it from a Schedule 1 to a Schedule 3 drug. Next slide. So that was a very quick overview of the policy landscape. I'll be happy to answer questions at the end of the webinar, but now I want to hand it off to Kathleen, who is going to talk about cannabis basics, products, and terminology.
Yeah, thank you, Tracy. Yes, I'm Kathleen Link. I'm also a proud graduate of the University of Minnesota. As Tracy mentioned, I got my master's in public health in 1999, and happy to be among all our alumni here. I'm going to be talking just about some terminology and then a few slides on different types of products and how they're used. So this is all just in general information, and then we'll move into some specific cannabis research that we're doing at the center, and that will be Julie and Eileen. So just to get us all on the same page with some terminology, cannabis is the scientific plant name. It can sometimes refer to cannabis sativa or cannabis indica. And then the psychoactive component, the part that gets you high if you use cannabis, is THC, or tetrahydrocannabinol. Generally, when you hear THC, you think of Delta 9 THC. There are all different types of THC, but Delta 9 is by far the one that is most abundant in the cannabis plant. And so generally, whenever you hear anything about THC, it's generally talking about Delta 9. However, there are many different types of THC that are in smaller amounts in the cannabis plant, such as Delta 8 and Delta 10 and others that you may hear of. But just for our purposes today in particular, when I'm talking about THC, I'm going to be talking about Delta 9. And then you may have heard of CBD. That's another component of the cannabis plant, but it is not psychoactive. So that is not going to get you high as THC would. You heard about hemp from Tracy. It's also a cannabis plant that's very low in THC. And historically, as Tracy said, it's just been used as a fiber source. So it's in general only not until that 2018 bill do we really hear about hemp in any kind of product that would be psychoactive. And I just want to mention the term marijuana. Really, marijuana and cannabis can be used interchangeably. They're really talking about the same thing. Marijuana is the term that the federal government uses. But in general, in science, and certainly at our center, we use the word cannabis. Marijuana does have some racist connotations, which is one of the reasons, but also just because cannabis is the scientific name, we use that. Next slide, please. So on the next few slides, I'll just be talking about some types of cannabis products. First we have the flower, the raw plant material. Might be called bud or leaf. There's a picture of cannabis bud. And all other products, all other types of cannabis products come from this raw plant material. So either some kind of extraction or other method is how we get other products, such as the edibles, which are the gummies, baked goods, etc. Different types of beverages that Tracy mentioned. Seltzers are very common here in Minnesota. And then there are concentrates. And I'll explain more what these concentrates are, but they tend to be oils and waxes and a few other types. So how potent are these different products? So again, I'm talking about the THC content. It tells us how potent the products are. So you may have heard about how flower, the actual plant, back in, say, in the 70s to the 90s, it was much less potent. So it's like 2 to 5% THC was on average in the plant. Today, the plants have like 15 to 20%. So it is more potent than previously. Now, what about edibles and beverages that are made from cannabis? It can really vary. It depends on how they're made. Typically, there may be 5 or 10 milligrams of THC per serving. They're described in milligrams versus percent. Some states, as Tracy mentioned, Minnesota, put limits on the amount of THC in a edible or a beverage. It could be limits on the per serving or perhaps the package. And then we have the concentrates, and these are the ones that tend to be higher in THC. So oils that are like 40 to 60% generally, and then wax, shatters, and some others that it can be up to 90% THC. I'll explain more about those in the next. So we have different methods of using. We all know about smoking cannabis. Smoke the flower, pipes, joints, bongs are the most traditional way. Of course, they're also very familiar now with eating and drinking. And then there's vaping. Vaping is not smoking, it's vaping, so it's a vaporization process. It's usually through a vape pen, which is pictured there, the second photo, or sometimes they're called carts, which is short for cartridges. So it's a vape oil that's in the pen. And then there's dabbing, which is what is the term used for the high potency concentrates. And I'll explain that on the next slide. So there's different types of these high potency concentrates. There's shatter, which looks kind of like a rock candy, which is in the top picture there. There's wax, which is a more sticky substance. It's like honey. There's other terms that are used for it. Sometimes it's called butter, BUDDER, or BHO, which is butane hash oil. But these are these high potency products. And then it's called dabbing because a dab is heated, often using a torch or perhaps a water bomb, and then the vapors inhaled. So it is a vaporization process, but different than the vape pen cartridges. Next. So because you're using different types of products and different ways to use them, we have different intoxicating effects. So smoking and vaping generally is an immediate intoxication effect as soon as you inhale, and the full effects usually peak about 30 minutes and they last just maybe an hour or so. It depends, it can vary. But eating and drinking is quite a bit different. There's definitely a delayed effect. 30 minutes, usually the effect, maybe even longer. And then they definitely last a lot longer, these effects, usually about 4 hours. Dabbing to high potency, as I said, it's basically a vaping. So there is that immediate intoxication effect, but generally a greater intoxication per dose. So each time you inhale, you're getting a much greater dose than you would like in a regular vape kind of. And so that was just giving you a little idea of all the different products and terms. And now we're going to move on to some of our actual research that we're doing at the center.
Hi, thanks, Kath. So my name is Eileen Delahanty. I am a research associate here at the Cannabis Research Center. I did both my Master's of Public Health and my PhD here at the U in the School of Public Health, and I'm really happy to be talking to you today about one of the studies that we did here at the CRC. So, as probably all of you here know, the Minnesota State Fair is a huge gathering of Minnesotans. It runs for 12 days from late August to early September. And there are about 150,000 attendees per day. By attendance, it's the largest in the country. And people come from across the state to come to the Minnesota State Fair. So perhaps some of you know, but the University of Minnesota has launched the Driven to Discover program, and then it's hosted at the state fair. And what people can do, or what researchers can do, is that they can apply to have a survey at the state fair. And this is a really interesting way to survey Minnesotans because you can get a really diverse group of people and a pretty representative group of Minnesotans that would come to the fair and then complete surveys at the fair. So the Driven to Discover program or booth in 2023 had over 55,000 visitors. And there are a wide array of studies that are going on there. So, many through the School of Public Health, but certainly not all. Med school has a lot. It's really quite a wide array. Next slide. So I completed one of my dissertation papers using data that we collected at the Minnesota State Fair. So in 2023, prior to well, I guess it was about 2 weeks after Minnesota had legalized adult use cannabis, we had a survey at the Minnesota State Fair. This was before the Cannabis Research Center was in existence. So I was conducting research on cannabis prior to that. And this survey, this study that I was doing was funded by the Midwest Center of Occupational Health and Safety that's also hosted here at the University of Minnesota. And at this point in the cannabis policy landscape of Minnesota, most of the products that were available, actually quite similar to now, were hemp-derived THC products, but people really didn't know that much about them. There wasn't a lot of data about it. Certainly, we didn't know how prevalent use was here in Minnesota. And so one of the things that I really wanted to look at was what kind of products are Minnesotans using? We know that the cannabis landscape of Minnesota looks very different than other states. In other states, flower and dispensaries are open and are much more common. Here in Minnesota, it's really edibles and beverages, and that was even more true in 2023. We wanted to look at attitudes and perceptions of cannabis. What do Minnesotans think of these policies? Do they like them? Do they not like them? Are they supportive of them? What does it look like? And then finally, we wanted to look at workplace use and the policies around workplace use. As I said previously, this project was funded by Midwest Center for Occupational Health and Safety. Workplace use is obviously something they're very interested in, and so that was a major component of this study. So we surveyed Minnesotans 18 and older and had over 1,100 participants over the course of, I believe, 4 days at the fair. Next slide. It was very successful. So the 2023 survey allowed us to collect a lot of data, and successful enough that when the Cannabis Research Center launched later that year, we've decided to continue this data collection process. So in 2024, we included 2 county fairs. In addition to the questions that were asked previously, we asked about driving, co-use with alcohol, and then had I guess, a variety of other questions, but those are the 2 primary new topic areas that we covered. And we had over 1,600 participants. 2025, again, we collected a similar study or similar survey, and we're able to look over time. So had a growing number of participants, and this really allows us to look at trends. 2026, we were accepted again this summer and are really excited to be able to be at the Minnesota State Fair once again to really look at what do Minnesotans think about the cannabis policy landscape here in the state and what can we glean from this and then present to other stakeholders. Next slide. So we have a lot of information on our website about our state fair study and highlights in the specific topic areas. This is a relatively brief webinar. We've had other webinars purely on this topic, so we'll just highlight a few of the findings. But if there are others, if people have other questions, they can certainly go to our website and look at some of the other topics that we've dove in a little bit deeper to. So we were really interested on what proportion of respondents have used non-medical cannabis in the last year. And you can see that from 2023 to 2025, it really hovers around 50%. We don't see a big difference between 2023 and 2025. And I think that this is similar to what we've seen nationally as well. Next slide, please. One of the most, I think, interesting questions that we asked in 2023, 2024, and 2025, particularly because Minnesota's cannabis policy landscape is very specific around hemp-derived THC products, is if they should be regulated the same as other types of cannabis products. In Minnesota, they are not. They are regulated very differently than other types of cannabis products. There's no restrictions on the types of stores that can sell these products. Many people have probably seen these in their local supermarkets or gas stations, convenience stores, breweries, bars are all common places that these products are located. And that's different than non-hemp cannabis, which is only available in either medical dispensaries or cannabis dispensaries that are just opening. So go back a slide, please. So interestingly, over time, what we've seen is that more people think that these products should be regulated the same as traditional cannabis products. So in 2023, these products had been around for about a year. Adult use cannabis had just recently been legalized August 1st, and we did this study at the end of August. So it was very, very recent. There were no dispensaries available. But we see an increase over time on the number of people that want these products to be regulated the same. Next slide, please. When we asked what types of stores should be allowed to sell these products, this is also, I think, a very interesting finding because the proportion of our respondents who said that all stores should sell these products, which is allowed right now, right? All stores are currently allowed to sell these products in Minnesota, but this proportion has really gone down pretty substantially over time, from 37% in 2023 to 23% in 2025. I think it's also quite interesting to see that very few respondents say that no stores should be allowed to sell them. This sort of tells us that people want these products available, but they don't want them available everywhere. And really where we're seeing the big trend is that people want these available in only certain stores. They want these products limited to only certain stores. And one of the questions that we asked as a follow-up to this was, what types of stores should be allowed to sell these products? Among the people who said only certain stores, what did we see? So next slide, please. And by and large, what we found was that people who responded that they wanted them only in certain stores really wanted these stores in adult use stores, the THC specific stores, tobacco stores, liquor stores, and breweries. These were places that by and large people were okay having these products. A smaller proportion of people wanted these products in restaurants, coffee shops, grocery stores, and convenience stores and gas stations. And very few respondents wanted these products in hair salons, gift stores, bookstores, hardware stores. Now, to note that at least at the time of this study and still to this day, it is not uncommon to go to a hair salon and find these products. It's not uncommon to go to a bookstore and have them available because again, in Minnesota, these products are regulated differently than adult use cannabis. You can go to the next slide, please. So we find this data that I presented here very briefly, we find that this has been widely, it's been people have been very interested about it. So we've given a lot of presentations, we've taught several media interviews on it. We also have a research brief, which is where this QR code will take us and dives a little bit deeper into Minnesotans' views on THC gummy and seltzer policies here in Minnesota. This is, again, just a very, very brief overview of the things that we have looked at the Minnesota State Fair. We have a lot of other studies and a lot of other analyses that we need to run and have run, and that we'll continue to report on, especially as we continue the fair in this upcoming year. Now I'm going to pass it along to Julie, who's going to talk about a survey conducted with University of Minnesota students.
Thanks, Eileen. Hi, everyone. I'm happy to be joining you this afternoon. I'm also a proud alum of the University of Minnesota. I was realizing this morning I came to campus in 2005 to start my master's degree in public health, and I have never left. So I've been on campus for quite a long time. I earned my master's degree in public health in 2007 from the School of Public Health at the U of M. I earned my PhD in epidemiology in 2017 from the School of Public Health. I joined the Cannabis Research Center just about 2 years ago and serve as the research center manager. Prior to that, I worked at Boynton Health, the health service on the Twin Cities campus of the University of Minnesota for almost 18 years. So college students and college health are near and dear to my heart. So that's a population that I'm often interested in for a variety of health outcomes and health behaviors, including cannabis. And so I'm going to be sharing with you some information about U of M students. And this is the first time we're sharing these preliminary data. So I'm excited to share them with you, knowing that most people on this call did spend time on the U of M campus as students. So college students are an important population for us to think about when we're looking at health behaviors. We're looking at all populations. We're looking at middle school and high school students, adults, and college students. So back in the spring of 2024, when I was actually still working at Boynton Health, Boynton and the Cannabis Research Center collaborated to add some additional cannabis questions to an existing survey that Boynton administers approximately every 3 years on the Twin Cities campus, on the Crookston, Duluth, Morris, Rochester campuses. And in the past, they have administered the survey at other colleges in Minnesota as well. But we worked together to add maybe 3 or 4 additional questions about cannabis. And we found the results to be really interesting and important. And so that led us to launch our own survey in fall 2025, focusing pretty exclusively on cannabis so we could ask a variety of additional questions. So in fall 2025, we launched our own student cohort study, and that's what I'm going to talk with you about. So the purpose of this U of M student cohort study is to understand and describe experiences related to cannabis among U of M students throughout their student career. So we will invite them to participate in multiple surveys throughout their time at the university, and also capture important information as the legalization process in Minnesota evolves. So we're really happy that all 5 campuses are included in this cohort study. So we invited undergraduate first-year students on all 5 campuses to participate. Survey 1 was launched in fall of 2025. And again, it's just first year undergraduate students that were invited, but we will follow them through the next 4 years. We had 689 students complete Survey 1, which was a 22.4% response rate. And as I mentioned, we'll follow them over time. So the respondents who completed Survey 1 will also be invited to complete a similar survey, but we might change the questions to delve a little deeper in specific areas. But they will receive a survey in spring 2026, spring 2027, spring 2028, and spring 2029. And of course, they can choose not to participate in any of these surveys if they don't want to. So we administered Survey 1. We launched it in early October and closed it in late November. And we're just starting to analyze our data. And we have a lot of really interesting data. And we're going to share with you some preliminary information. And like Eileen just talked about, we have a lot of additional data that still needs to be analyzed. But we look forward to sharing that information on our website and future forms of dissemination. So first, we want to share some information about the number of students who have reported ever using cannabis. So keep in mind, I didn't mention this on the previous slide, but I should have. For our Crookston, Morris, and Rochester campuses, we invited all first-year undergraduate students who are 18 or older to participate. And then on the Duluth and the Twin Cities campus, because they have more students, we invited a random sample of those first-year undergraduate students. So important to keep that in mind when we look at these results. So about 31% of respondents reported ever using cannabis within their lifetime. Again, these are first-year undergraduate students. And of these, about 1/3 of respondents who had ever used cannabis reported that the first time they used it was at age 15 or younger. 42% of those who have ever used cannabis reported first using at age 16 or 17. And then 26% of respondents who have ever used cannabis reported using at age 18 or older. And then we asked about cannabis use in the past 12 months. Of our respondents, 88% have used in the past 12 months. And of that 88%, about 18% used on one day in the past 12 months, 28% used on 2 to 6 days, 10% used on 7 to 12 days, and then 31% used on more than 12 days in the past 12 months. Then we also asked about cannabis use in the past 30 days. So this question was asked of people who reported that they had ever used cannabis. So of the people who had used in the past 12 months. So of respondents who have used cannabis in the past 12 months, 74% reported that they have used cannabis in the past 30 days. And of these, 35% used on 1 to 2 days of the past 30 days, 10% used on 3 to 5 days of the past 30 days, 14% used on 6 to 19 days of the past 30 days, and 15% used on 20 to 30 days. We also asked about what types of products people use. So these are the types of products that Kath told us a little bit about. So of respondents who have used cannabis in the past 12 months, 78% of respondents reported that they have used edibles. 71% reported that they have used vapes. 53% reported that they have used smoked flower. 26% reported that they have used beverages, and 13% reported that they have used dabs. Then we asked respondents where they typically get their cannabis products from. So of our respondents who used cannabis in the past 12 months, about 67% typically get it for free or share someone else's. That's how they obtain their cannabis. 43% buy it from a friend, 25% buy it from a dealer, 20% buy it from a retail cannabis store, and 13% buy it from a different type of store, like a grocery store, a gas station, a mall, a liquor store, or a convenience store. And I'm just reporting for you the top 5 most common sources. There were a couple other sources that folks endorsed when asked the question. We also know that there's a lot of interest in cannabis use along with other types of substances. And so we asked a variety of questions about cannabis use, alcohol use, tobacco and nicotine use. So I'm sharing with you just some preliminary information about cannabis and alcohol use. So among those respondents who reported that they had used cannabis in the past year, about 53% of them reported that they used alcohol on the same occasion with cannabis. We also asked those folks who reported using cannabis in the past year how frequently they have decided to use cannabis instead of alcohol. 1/3 of those respondents said they have never decided to use cannabis instead of alcohol. 23% said they rarely choose to use cannabis instead of alcohol. 19% reported they sometimes decide to use cannabis instead of alcohol, and 25% reported that they often use cannabis instead of alcohol. And then we also asked these folks when they use alcohol and cannabis together compared to when they use alcohol without cannabis. Do they tend to drink less alcohol, more alcohol, or about the same amount of alcohol? So about 65% reported that they drink less alcohol when they use alcohol and cannabis together compared to when they use alcohol without cannabis. About 4% said they drink more alcohol in that situation, and 31% reported that they drink about the same amount of alcohol when they're using cannabis versus when they are not using cannabis. We have a lot of additional cannabis and alcohol use data that we are looking at. So these are just some preliminary pieces of information we wanted to share. And then we also asked a variety of questions about the effects of cannabis. And this series of questions lists a number of topics on the left, things like friendships, social life, quality of life, mental health, hobbies, recreational activities, family life, studies, physical health, and work. And respondents could let us know if they feel that their cannabis use has a positive effect, a negative effect, no effect, or not applicable. And respondents could select both positive and negative if that was true. And this question went to only respondents who reported that they have ever used cannabis. So this is a lot of information, and we're still thinking about what these information mean. But I wanted to point out that more than half of the respondents who reported they have ever used cannabis also report that their use has a positive effect on their friendships or social life. And just under half report that their cannabis use has a positive effect on their quality of life. And then taking a look at the negative effect, we see about 1/3 of respondents who report ever using cannabis report that it has had a negative effect on their physical health. And then we have a large portion of students who report that their cannabis use doesn't have an effect in several areas of their life. So that is just kind of a preview of some of the data that we have collected. As I mentioned, we have much more information to dive into. We asked these students questions about, have they operated a motor vehicle after using cannabis? Have they seen cannabis product advertising in a number of different places? We asked them questions about their mental health and about mental health and cannabis use. We asked about alcohol and tobacco use, the effects of cannabis legalization on their use. We asked them questions about their family life and kind of their family's thoughts on cannabis. And then we also asked several demographic questions. So we are continuing to analyze the results from Survey 1, and we look forward to launching Survey 2 in just a couple weeks. And so we really look forward to surveying these students throughout the next 4 years to see how their interactions with cannabis change over the next 4 years. So that wraps up the information that we are sharing, but I know that there are quite a few questions in the Q&A, so I'm going to hand it back over to Sam.
Awesome. Thank you, Julie, so much to you and all of our presenters today. It's been an active Q&A, so also thank you to all of you for already jumping in and answering some of the questions that came in. To kick us off, we have a really wonderful question submitted by Abdul Omari. Given the history of using certain drugs, in this case, cannabis, to discriminate against poor communities and specifically Black and Brown people, particularly when it comes to incarceration and the impacts of criminal records, what's being done in that space? For example, releasing people from incarceration, removing convictions from records or reparations, etc.
That's a great question. Thank you so much. As I mentioned, we definitely care about issues related to equity. And we have been doing a few things to start off really looking at to help us figure out actually what research questions we need to answer going forward. So one of the things we did is something called the scoping research literature review, where it's just looking at what research has already been done, focusing on equity related issues. And so we actually found that there's a lot of room for more research on a variety of different topics. We also conducted focus groups with African American and American Indian community members, just to find out what were some of the concerns, some of the issues that they were dealing with, or what are the questions that they want to know. So we are just kind of wrapping up those projects and starting to think about where can we build collaborations and partnerships to better answer research questions about effects of decriminalization, effects of expungement of records. And some of that research is difficult because of the data that are not available to us. But we are very open to hearing what are the questions that people have and then trying to figure out if we can answer it or if we can fund some other researchers on campus to answer a variety of questions. So I didn't give you the perfect answer to your question, but just know that it is something that we are focusing on and will continue to figure out how to answer as many questions as we can related to equity. And I don't know if anyone else on the team wants to jump in.
I'll just add that it's not Cannabis Research Center work, but it appears that there is a fair amount of work being done in the state of Minnesota to educate folks about expungement. So folks who do have records related to cannabis use. And I can put a link in the chat if can I put stuff in the chat, Sam? Yes. Okay. I'll share some information in there about what Minnesota is doing to make sure folks are aware of what expungement looks like and how they can get help navigating that process, because my understanding is it can be a complicated process.
All right, I'm going to keep going. The next question we have, given the health risks to youth, do you recommend an abstinence-based youth education on this topic?
I can start with that one. So when Minnesota put the law in place legalizing adult use cannabis, the law is very long, and it also touches on many aspects of life in Minnesota. And one of the things included in the law, the statute, is a requirement about education programs that will be required in Minnesota high schools and middle schools starting in the 26-27 school year. And so there are lots of suggestions and requirements about what those education programs contain. And so definitely evidence-based education is really important. And so I can add that link in the chat also that gives more detail about what those programs, what is required of those programs. But we've partnered with the Minnesota Department of Education to learn more about the needs of school support staff within middle schools and high schools. And I know that the Department of Education is doing a lot of work to prepare schools for when the requirements go in place this upcoming school year.
And I'll jump in is that, we want to do everything we can to support the schools and help them comply with the law and get the best programs in place that are effective in preventing young people from using cannabis. And we know from alcohol and tobacco that school-based programs by themselves are not going to be sufficient to prevent young people from using. We need to consider where are they getting alcohol, tobacco, and now cannabis. And so, we're asking young people where they're getting it, from college students to younger age groups. And we're looking at the likelihood of access from different sources. And Eileen has led a series of phases of the same study looking at the likelihood of illegal sales from particularly the retail establishments that sell hemp. And if there's questions around that, Eileen can certainly answer them. But we want to look at both the school-based side, education side, as well as cutting off the likely sources to young people.
That makes a lot of sense to think about this on all the different angles that folks would be interacting with cannabis, whether that's through parenting or their own influence. The next question we have is actually related to the sales piece. You've mentioned the slow rollout and ambiguity about retail cannabis and hemp products. What is the situation for plant nurseries and similar businesses, since home growing for personal use was also decriminalized?
So I'm not completely sure I fully understand the question. So, I mean, yes, home growing is allowed, and the state is, administering license for businesses to grow the product. That is not an area that we have focused on, although we have had communication with people that work in extension about, if people are going to grow the product at home, that they know how to do it safely. Cannabis is a plant that will absorb metals from the ground, and so it's not my expertise, but there are things that we know that businesses and people at home need to do to make sure that the product's as safe as possible. So if there's more specific questions than that, I need that specificity.
Yeah, I'm interpreting that as like maybe needing or wanting to know more about a legal way to actually buy the plant. So I don't know if you can speak to that part at all.
That I can't. I don't know if anyone else on in this group can.
So legal way to grow your own at home, is that what you're saying? Because there's
Just rules around it.
seeds and how many plants that you can have and that type of thing. So I kind of understood as wondering whether nurseries could be growing plants, and they cannot, it's only the licensed grow facilities that can actually grow plants, and then people at home, but not nurseries.
And the rules around like growing at home are very specific, as Kath mentioned. But if there's very specific questions about some of the laws, the Office of Cannabis Management website does break it down, some of the specificities of Minnesota law, which can be helpful.
That's a good referral source of truth for folks to reference as well. This was probably a question for Julie, but the whole group. How do the results of the college student cannabis use compare to other studies for non-college students? So maybe youth that are just in the general population.
That is a great question, and we are just starting to look at the information. So it will be important for us to look at these data in context with the younger folks and the folks beyond college age, and also important to look at young adults who aren't in college. So I think we will have much more to say about that in the coming months.
And we do know for alcohol that kind of throughout the past few decades, we do see differences between young adults that are in college and young adults who are not in college. And so sometimes it's harder to do surveys of the young adults that are not in college, but it's definitely a population that we will want to try to figure out how to connect with and collect some data from.
That makes a lot of sense. We have a couple questions in here I'm going to try and kind of summarize around driving and safety and policy related to some of those pieces. Could you speak at all about kind of how are they determining policies around that when you take into account tolerance and how individuals may have different levels of tolerance?
So we can't speak for legislators. People would have to talk to legislators about how they made the decision, but it's not legal in Minnesota to drive after um, driving while high. Now it gets very complex as the person who asked the question kind of gets at is that, you know, the THC can stay in the system beyond when people are feeling the intoxicating effects. It's very complex. I know that people in Minnesota, not at the Cannabis Research Center, again, that's outside of our charge and our expertise. But there's researchers also outside of Minnesota that are trying to assess um, how do we determine when someone is high on cannabis, and can we come up with a measure of that? Um, we know so much more around alcohol use and driving and the risks, even at lower BAC levels. That research is still needed in this area. And if anyone wants to jump in, please do so.
I'll also mention very briefly that with our state fair study, we're assessing the proportion of respondents who report both driving a motor vehicle, but also things like driving a tractor, driving a boat, driving an ATV, riding a bicycle. These are things that we also want to consider and are looking at for like at the CRC and have been studying it because there aren't a lot of data sources out there until we started collecting this.
Amazing. Well, thank you all so much. I know we're coming up on time here, so I'll throw one last question to Tracy in the group. Is there anything you wish you touched on today that you didn't quite get time for, and where can people learn more? I know you've provided some excellent links already.
Yeah, so we're collecting so much data and accessing so many data sources that we have so much more to share. And so please go to our website. If you look at the cannabis research that we have completed or conducting, and there's links to some of the briefs that we have posted. And we're just trying to do as much as we can and get as much information out to all of you. And follow us on LinkedIn, sign up for our newsletter. Let us know what you're interested in learning more about, and we'll do our best to try to address your questions and your interests.
I just want to, one of the questions is about getting copies of our slides. I know that this will be recorded, but are slides also shared, and do we want to share them at this point? I know some of these are preliminary data, so I wasn't sure. Tracy, it's kind of to you.
Yeah, we're always cautious when we have preliminary data. So particularly with a college cohort. So we maybe could share at least some of our slides that where we have finalized some of the data collection, and certainly with the terminology. And so if that's possible, we could figure out what slides we can share.
I'd be happy to include that in my email recap. I know Haley also put the email address for the Cannabis Research Center, so folks could probably also follow up directly if they're especially interested in that. And if it's all right with you, I'm going to close this out for the day. thank you all in the audience for attending and for your attention and asking some wonderful questions. And thank you, of course, to all of our wonderful panelists and presenters today from the Cannabis Research Center. This is such an interesting topic with so much more we could have gone into. So I look forward to future collaborations with you all, and I thank you again for your time today. Have a wonderful day, everyone, and tune in to future webinars. Thank you.